Casco Wholesale Corporation operates in a complex structural position within the healthcare supply chain. They are simultaneously a self-funded employer plan sponsor, providing health benefits to over 300,000 people, and a global retail pharmacy operator. As a plan sponsor, Costco utilizes Navitas Health Solutions to execute a 100% transparent, pass-through pharmacy benefit model. Manufacturer rebates are returned in full to offset high-cost claims and reduce employee premiums. Traditional pharmacy benefit managers typically generate margins by retaining a percentage of manufacturer rebates and creating rebate walls that keep list prices inflated at the pharmacy counter. Costco's benefit structure aligns with a broader market shift toward transparent platforms, such as Mark Cuban Cost Plus Drugs, which enforce pricing clarity through flat-rate markups and direct cost disclosures. However, Costco's retail pharmacy operations face a different economic reality. To navigate narrow dispensing fees, the pharmacy side must maximize volume-based generic rebates from major pharmaceutical wholesalers. This creates an operational tension. The organization must zero out PBM rebates for its employees, while maximizing wholesaler rebates to maintain its retail inventory margins. Managing these high-volume rebates involves a multi-layered lifecycle. Claims move from point-of-sale adjudication to inventory procurement and retrospective reconciliation, a process that can span up to 180 days post-dispensing. Manual processing across this timeline leads to margin leakage, unit-of-measure mismatches between manufacturers and pharmacies, or data discrepancies in disconnected databases result in rejected claims and excessive balance sheet reserves. These disconnected tracking methods carry regulatory risks, as demonstrated by a recent West Virginia Insurance Commissioner's audit of Navitas Health Solutions. While Navitas passed through 100% of direct rebates, their manual systems failed to capture West Virginia's specific statutory definition of indirect manufacturer payments. Relying on manual compliance checks to track state-specific regulations creates a structural vulnerability. Without automated semantic intelligence, platforms face recurring penalties and margin loss. In retail operations, pharmacy vendor agreements use an asymmetric pricing structure. Brand name medications are billed at a thin discount off the wholesale acquisition cost, while generic drugs generate the majority of the margin. This graph illustrates the generic compliance ratio, or GCR. Wholesaler generic rebates are paid on a nonlinear step function. High compliance percentages yield escalating rebate tiers. The economics are sensitive. If a local pharmacy manager attempts to save on the invoice price by purchasing a generic drug from a secondary supplier, that single localized purchase dilutes the global GCR denominator for the entire enterprise, pulling the ratio downward. Dropping even a fraction of a percent below a tier boundary triggers a loss of retrospective rebates across all generic purchases for that period. This loss often erases the initial invoice savings. The math is unforgiving. A human procurement manager cannot calculate the global enterprise-wide GCR impact of a single local purchase in real time. Automating these margins requires extracting the complex conditional matrices buried in unstructured contract PDFs. Standard natural language processing and binary knowledge graphs struggle here. When multiple conditional variables are introduced, pairwise relationships fail to capture the overlapping dependencies, causing the data structure to fragment. The solution is hypergraph RAG. Instead of simple node pairs, a hypergraph utilizes hyperedges that connect an arbitrary number of entities simultaneously. A single contract clause is modeled as one structure containing the manufacturer, the drug NDC, the formulary tier, volume thresholds, and rebate percentages. LLMs use strict pedantic JSON schemas to force these unstructured clauses into strongly typed, machine-readable databases. By structurally preserving the multi-party context, this architecture prevents relational fragmentation and eliminates the risk of AI hallucinations when reading dense legal documents. These structured contract terms are fed into a real-time predictive mathematical optimization engine, monitoring daily purchase orders and wholesale pricing. This equation defines the engine's objective: to minimize the net of rebate acquisition cost across the entire pharmacy enterprise. The model recursively simulates every daily variation in product demand and supplier purchasing mixes. When a secondary supplier offers a temporary generic discount, the engine calculates the impact on global generic compliance. If the diversion drops the enterprise below a GCR tier boundary, the system identifies the net loss and blocks the automated purchase order. By calculating the global GCR impact before an order is placed, the engine prevents localized procurement from breaching a tier boundary. This secures the net of rebate margin by mathematically validating every purchase against the multi-layered wholesaler contract. The final workflow hurdle is automated exception triage. This requires cognitive flexibility that rigid if-then scripts cannot provide. This multi-agent system utilizes bounded AI agents that interpret context to pursue specific goals. When an invoice arrives, a document capture agent parses the layout and passes the transaction to a data normalization agent. The normalization agent cleanses the data by translating unit of measure mismatches, mapping liquid medications billed by the milliliter to inventory tracked by the bottle. A matching agent correlates the cleansed invoice against both the Hypergraph contract database and ERP receipts. Matches move to payment execution, while discrepancies are routed to an exception handling agent. These agents resolve data discrepancies autonomously, preventing disputed invoices from becoming long-term balance sheet reserves. To protect sensitive health information, the entire architecture must operate securely within an isolated, HIPAA-compliant virtual private cloud. Inference tasks are executed with a no-training default, ensuring proprietary contract terms are never utilized for public model training. The system connects with native enterprise ERPs, like SAP Vistex or Oracle Cloud, to ensure data exchange is seamless. In this model, the native ERP serves as the transaction ledger, while the Agentic AI overlay manages unstructured document extraction and predictive optimization. This hybrid architecture provides the unalterable transaction security of a legacy ERP alongside the cognitive intelligence required to scale modern operations. Validating contract terms at the individual NDC level eliminates the 4% to 5% revenue leakage typically lost to uncompliant claims and overpayments. Automated contract parsing reduces document review times from 30 minutes to under 20 seconds. This system safeguards the high-tier generic wholesaler rebates that average $17,500 monthly for every retail pharmacy location. Operating this dual-role supply chain requires replacing manual spreadsheets with cognitive architectures that mathematically optimize every transaction.